I'm Dr. Christine Gleason. I work for Rogue Community Health. I'm the coordinator for the Upper Rogue Transportation Project. We're trying to solve transportation challenges for the rural communities in the Upper Rogue. Ultimately, its goal is to reduce the burden of transportation for folks in these rural communities so that they can achieve vibrant health.
My name is Angela Ellis Wells, and I am the program director for the Butte Falls Community School Partnership at the Landing. For our community to have access to transportation to get our senior citizens down the hill and our vulnerable populations the services that are necessary is vital to our community.
Folks choose to live in these small communities for a lot of reasons. There's a lot of value to them in these locations. It does make it difficult if you're transportation limited to access things like healthcare and dental care and behavioral health support.
My name is Diane Gorman. I'm currently the president of the board of the Butte Falls Community School Partnership. 2 years ago, I retired from being the principal at the school, and now I own the gas station in town. We have a fully functional mechanic shop, and that has been a huge help to our town. Our mechanic is pretty amazing, and he helps out those people who need just a little fix on their cars to keep them running.
The Upper Rogue Transportation Project is a project that seeks to keep people's own vehicles operational and on the road. We also seek to bring in vehicles and supports through a community-provided vehicle or also rideshare providing through friends and neighbors.
We've never had that service before, so that would be a huge impact on our community. It might take a little bit of time for it to actually pick up, but once it's there, it will be utilized.
Rogue Community Health is using the framework for the 7 vital conditions to inform a lot of the work that they're doing in these communities. If you have these 7 things, then you have the opportunity to live vitally. All types of things that increase health, transportation being one that is that multi-lever that hits across several of the modalities. There seem to be these pieces that were critical to making a project go. And we're hoping as time goes on that folks will look at these 8 pillars and say, these are the 8 things that I should be keen in on, or 6 of the 8. Pillar 1 is where a community has a desire to make changes for the benefit of the community. They've self-identified that there is a need and they are actively looking for solutions.
You have people that can't make it down the hill, and I know that sounds really ridiculous, but the barriers are here, and we've got to find a way to overcome them.
Pillar 2 is the idea that transportation specifically was identified as a need in a community.
If you want good health care, you need to go down to Medford. People might go to the clinic and get referred, but then they have that bigger issue of how do I get to town? I know several people that don't even own a car.
Pillar 3, we strongly suggest that a group within the community is identified early that has some social capital in that community.
Our facility has partnered with a lot of different entities in the last couple years to provide better services to our community. What I've seen is a lot of connecting with resources that are necessary because we have different populations that are underserved.
Pillar 4 says that you would do best if you had some type of host agency supporting the work from the outside. Pillar 5 is this idea that the person that you bring into the community to work with the community should have some familiarity, lived experience in a rural setting, some ability to connect to those community members. Pillar 6 is really that community engagement piece. The project lead has the community engagement skills to bring the community together, facilitate community meetings, develop community agreements, those types of things. Pillar 7 states that you need to be recording metrics for the project. You need measurable results. So we're looking for data integrity, and metrics that we can use authentically to continue to improve the project. Pillar 8 is this idea that it's a feedback loop. The feedback loop also comes from the community itself. What are their feelings about it? Is it a positive change? What could be better?
In our town, everything starts out slowly. Once it gains momentum and people know about the service and they know that it's available to them, it will grow. And having a partner like Rogue Community Health is vital.